Okay, so welcome to the neonatal resuscitation scenario or module of OneSim. Okay, before we go on to a scenario, we'll start off by looking at the equipment one needs for neonatal resuscitation, and then we'll look at the doll we'll use to simulate neonatal resuscitation in OneSim. All right, so please come through, and we'll look at some of the equipment which we may need during resuscitation. So I would start from the top. The first thing which you need is probably a heating source and some blankets to keep the baby warm. Okay, so we have a blanket to receive the baby. We might have an extra blanket to get the baby, and we generally have a beanie. So we have a beanie here to keep the baby warm later on. Okay, the heated source might be a resuscitator like this in your hospital, or you might just have a heated lamp as the heated source. You obviously need a flat bed to keep the baby on. So the flat bed might be a table, or it might be a resuscitator like you see here. Okay. For the airway, the most important piece of equipment you need for the airway is the self-inflating bag. Okay, in your hospital it might be an ambu bag like this one, or it might be another self-inflating bag. Generally the self-inflating bag is connected to an oxygen source or a blender. It depends on your resources available. Okay, it also has a reservoir to help with enriching the oxygen. You might have a couple of different sizes of masks for the baby. Alright, you might also need a suction catheter to suck the baby's mouth and nose if the baby has any secretions. For intubation, you need a laryngoscope handle and two different types of blades, one for a smaller baby and one for a bigger baby. And you need to have a variety of endotracheal tubes. Okay, so over here I've kept a variety of tubes starting from 2.5 millimeter up to 4 millimeter. So they go up in gradations of 0.5. So you have a variety of 2.5, 3, 3.5 and 4 millimeter endotracheal tubes. You may need a gastric tube and a syringe to empty the stomach if the stomach distends due to positive pressure ventilation. You may also have other syringes to give drugs, and the drugs which we need in resuscitation mostly are sodium chloride or normal saline and adrenaline, which is 1 to 10,000. Okay, if you intubate a baby in some centers, you might have a CO2 detector like a pedicab. You will also need tapes to secure the tube if you end up putting an endotracheal tube in. So before we do a scenario in OneSim, we are going to familiarize ourselves with a newborn mannequin or doll. Okay, so this is a term size neonatal or newborn mannequin. We want to come close and get used to the doll. Right? So the doll obviously is not real, but what we'll be doing is we'll be simulating what is happening on the doll, what happens in real life. Okay, so you can do resuscitation through the mouth and nose. You can do chest compressions like normal. For all other parameters, I'll be giving you guidance on what is the baby's condition like. Okay, so maybe it's a good idea for you to just practice on doing resuscitation on this baby. One, using the bag and mask, the self-inflating bag, and secondly, coordinating that with chest compressions. So Pramod, do you want to show us?
Sure. I'll be starting with the self-inflating bag, and before I start bag mask ventilation, I'll make sure that the mask is appropriate size, which covers the mouth and nose, but is free of the chin and doesn't go on the eyes. So this is appropriate size mask. So we'll connect with the self-inflating bag, and I will keep my two fingers on the mandible and middle finger on the chin to do the opening of the airway, and then we'll start positive pressure ventilation bag mask. So I'll be giving positive pressure ventilation at the rate of 40 to 60 breaths per minute, and every time I have to make sure that I'm giving effective chest ventilation by making sure that there is chest rise and fall with each breath. Okay. And other way of making sure that I'm giving effective ventilation is the baby's color will start improving as well as the heart rate. will start improving, and when you auscultate, you can listen for the breath sounds in the both the axilla. Okay. So hold mask on the face, okay, firmly, so that there is no leak. Then hold the bag with your right hand, and then just, okay. So there might be a leak, okay, now you are doing good. So you can see the chest rise now. Okay, so you have to keep that rate at 40 to 60 breaths per minute.
Yeah.
Okay, good. Oh, Max, but make sure that these are the connections which can become loose. Okay, so make sure you hold the mask tight. Yeah, very good. Yeah. So there is good chest rise. Okay. So the next stage is, if at all, after giving 30 seconds of effective back mask ventilation, if the baby's heart rate is still not improving, baby is still heart rate is less than 60, the next stage is starting chest compression. Okay, so the chest compression can be done by two methods. I'll show you. One will be just two-finger technique, and I'll show the anatomical landmark, or usually the lower half of the sternum. So the imaginary line between between the nipples, and you have to go one finger breadth below that. Or another way is you look at the GP sternum and then just go one finger breadth above that. So that is the area where you need to compress. And every time you compress, you make sure that you compress the chest anterior 1/3 chest is usually compressed. Okay, so 1, 2, and 3. So this is effective chest compression, and you always coordinate with the breath. Okay, positive pressure breath. So in the ratio of 3 chest compression as to 1 breath. So this is one method, two finger, but you can easily get tired. So you should have the full encircling of the chest and giving the compression with both the thumbs at the same anatomical landmark. And with that, you'll be doing 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. Okay. So what we will do, we'll just try to coordinate it with both of them. So what I'll do the chest positive pressure ventilation. So do you want to come across and give the chest compression? Okay. So ideally, you should be standing on the right side of the baby.
Sure.
Or depending on, or so yeah. Okay. So get your anatomical landmark. Yeah. And yeah, so 1, 2, and 3 and breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. And 2 and 3 and breathe. Breathe. 2 and 3 and breathe. 2 and 3 and breathe. 2 and 3 and breathe. 1 and 2 and 3 and breathe. 2 and 3 and breathe. Breathe. And then 2 and 3 and breathe. Okay. Alright, so what have you do now is coordination. So you do this positive pressure breath, and you do the chest compression. Okay? And someone has to call it so that you do it coordinated.
1, 2, 3, breath. 1, 2, 3, breath. 1, 2, 3, breath. 1, 2, 3, breath. 2, 3, breath. 1, 2, 3, breath. 2, 3, breath. 1, 2, 3, breath.
Okay, I think that's well done. So that's how it should be coordinated, with the range of in a minute we should have 90 events of chest compression and 30 events of positive pressure breaths. Okay. Alright, okay, so we are expecting hopefully a possible high-risk delivery, so I would need one of you to assist me in assessing the heartbeat, or if there is additional need for the baby's resuscitation. So we'll get the heat source started. So this is our heat source. We got the beanie to get the babies prevent heat loss. We have got the suction, so can we turn the suction on, please? Okay, so the suction is on. We've got the self-inflating bag already with attached mask. Okay, and that is working well. So we are all ready for the receiving the baby. Okay.
Okay, so this is a term baby. Please ask me for any assessment you need to make on the baby.
Okay. Thank you. You got the baby. So we will keep the baby nice and straight here. So we'll try to dry and stimulate the baby. So that will provide the stimulation for the baby, and same time we'll clearly open, clear the airway. So we'll open, suction the mouth and open the airway. So baby is now here, is in the sniffing position. So is baby breathing or crying now?
No.
And what is the baby's heartbeat? So can we assess heartbeat, please?
Baby's heart rate is less than 60 per minute.
Okay. So we'll start with the positive pressure ventilation first. So with the bag mask ventilation, so 1, 2, and 3. So we'll start with a breath of 40 to 60 breaths per minute. So can you put the baby, the beanie on the baby's face, please? So we've been ventilating this baby for 30 seconds. What is the baby's heart rate doing now?
Heart rate is still less than 60 per minute.
Okay. So can you assist with me with the chest compression, please? So we'll do with the 3:1. Okay. So 1 and 2 and 3 and breathe, and 2 and 3 and breathe, 1 and 2 and 3 and breathe, 1 and 2 and 3 and breathe, 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 2 and 3 and breathe, and 2 and 3 and breathe, and 2 and 3 and breathe, 2 and 3 and breathe, and 2 and 3 and breathe, and 2 and 3 and breathe, 2 and 3 and breathe, 2 and 3 and breathe, 2 and breathe, 2 and 3 and breathe. So we're doing this for the last 30 seconds. What is the heartbeat now?
Baby's heart rate is more than 70.
Okay, so we'll stop chest compression. So we'll still keep going with the positive pressure ventilation until we establish spontaneous breathing, or until the baby keeps crying. Okay. Okay, is baby now breathing, or?
Baby is starting to make some breathing efforts.
Okay, good. So I'll just keep supporting for a little bit longer until baby starts crying or establishes breathing.
That should be fine.
Okay. All right. So now the baby is crying, so we'll stop giving any positive pressure ventilation, and we'll observe the baby for transitioning with establishing the monitoring heart rate and spontaneous breathing. Okay.
Okay, to summarize the neonatal resuscitation scenario of OneSim, there are a few things I want you to always remember. The most important thing for a newborn baby is to provide enough warmth. So a heated source of heat and a beanie on the head, because the head is a big source of loss of heat. Okay. After that, the most important steps for the baby's resuscitation involve provision of positive pressure ventilation through a good sized mask and seal and using a self-inflating bag. If you have facilities to have a T-piece resuscitator in your hospital, please use that, but otherwise we need a good sized mask and a self-inflating bag, and that will do the job. If the baby's response to positive pressure ventilation is inadequate, that means the heart rate is still not rising despite 30 seconds of positive pressure ventilation, we need to give chest compressions like you saw in the scenario. Those chest compressions need to be coordinated 3:1 with breathing. So 3 chest compressions for every breath. Okay. Neonatal resuscitation is a team effort, and for that a team needs to be alert and anticipating all the problems that a baby might be having during the time of resuscitation. If the baby is anticipated to have trouble at birth, the team should be alerted as soon as possible. Otherwise, if it's an unexpected poor condition at birth, team should ask for help as soon as possible. Okay, so just going through the steps of neonatal resuscitation. First is initial steps, where we provide warmth to the baby, suction the mouth and nose if required, give a good head position and stimulate the baby by rubbing the feet or the back. After that initial steps, the assessment goes on to look for breathing and heart rate. If the breathing effort is poor or if the heart rate is less than 100, positive pressure ventilation needs to be commenced. That positive pressure ventilation should lead to effective chest rise. Following that, if there is poor heart rate of less than 60 despite 30 seconds of positive pressure ventilation which is effective, then we need to start chest compressions like I just spoke about. For the success of neonatal resuscitation in most babies, only these basic or initial steps and initial positive pressure ventilation will do the job for most babies. There are very few babies who need intubation or who need drugs to stabilize them at birth. Thank you.